Good morning, students. Here we continue with the ligaments of the knee joint and we are going to finish it off today. So, in the remaining part of the ligaments of the knee joint, we shall discuss the coronary ligaments. Then we are going to discuss here the transverse ligament, and then we are going to discuss the meniscofemoral ligaments. The meniscofemoral ligaments, and then we are going to discuss the last. They are the semilunar cartilages. They are known as menisci. So we are going to discuss the medial meniscus as well as the lateral meniscus. So therefore, these are the remaining ligaments that we are going to discuss today. Coronary ligament. In order to understand the coronary ligament, we shall first draw this usual line diagram. Now, this is the line diagram of tibia, superior surface, the medial and lateral condyle, on which we are going to draw the semilunar cartilages. So, this will be the semilunar cartilage here. This will show as the medial meniscus. Here we are showing this as the medial meniscus. Shape of medial meniscus will be, it will be semilunar in shape, oblong semilunar, and then we are going to show here there will be the lateral meniscus. This lateral meniscus will be circular in shape. So therefore, this is circular in shape. The entire lateral meniscus here. We are going to put some color inside. And this completes the superior surface of the transverse section. Superior surface of the transverse section of the tibia, in which we have the medial and lateral condyles. So this will be the medial condyle, this will be the lateral condyle, this will be the medial meniscus, and over here this will be the lateral meniscus. So this completes our diagram for today. Now, coronary ligaments. In order to understand the first ligament, here I am going to take it coronary ligament. It is a part of this coronary ligaments. They are sometimes asked as one mark question answer or MCQs. The coronary ligaments are part of fibrous capsule that will provide attachment to the peripheral part of the menisci. So therefore, we know that the fibrous capsule will be attached peripheral to both the menisci. That means the inner surface, the inner lining of the fibrous capsule of the knee joint will provide attachment to the peripheral portions of the menisci that we have discussed in the previous segments in the capsular ligament. So the inner surface of the capsular ligament of the knee joint will provide attachment to the peripheral portions of the menisci. So here, this will be the fibrous capsule. This will suggest the fibrous capsule on either side. This is the fibrous capsule. And this fibrous capsule, the inner surface of fibrous capsule will provide attachment to the peripheral portion of both the menisci, which we are showing in diagram. So therefore, the portion of fibrous capsule that provides attachment to the peripheral portion of the menisci is known as coronary ligament. So this will be known as coronary ligament. Even here, I can name here, this will be known as coronary ligament. So on both the sides, the part of fibrous capsule that provides attachment to the peripheral portion of the menisci, medial and lateral menisci, will be known as coronary ligaments. So here we have finished our coronary ligament. This much you need to understand. Second, transverse ligament. Transverse ligament, very simple. The anterior horns of, this is anterior, this is posterior. Of course, this is tibial tuberosity here. The anterior horns of both the menisci are connected to each other with the help of transverse ligament. So therefore, here I shall draw the transverse ligament. This will be the transverse ligament. The anterior horns of medial and lateral menisci are connected to each other by transverse ligament. So therefore, this is transverse ligament. So we finished coronary ligaments, we finished transverse ligament. Now we come across to meniscofemoral ligaments. Very interesting. These meniscofemoral ligaments, there are two, anterior and posterior. They are always asked in MCQs or 1 mark question answer. For that we need to understand posterior horn of lateral meniscus. Now this posterior horn of lateral meniscus we need to understand. Because from this posterior horn of lateral meniscus, it will be connected with the medial condyle of femur, above, medial condyle of femur, with the help of meniscofemoral ligaments. So therefore, this posterior horn of lateral meniscus will be connected to the medial condyle of femur above with the help of meniscofemoral ligaments. For that we need to draw another diagram. So please come on this side here. We are going to draw, these are the condyles which we show of the femur. As usual, medial condyle, lateral condyle. Here we are going to show this as the tibia. So this portion will be the tibia. Of course, medial and lateral condyle. This will be once again medial condyle and lateral condyle. On this medial and lateral condyle, we are going to show the semilunar cartilages, cross section of the semilunar cartilages. So here, this is the lateral semilunar cartilage, which is known as lateral meniscus. This is the medial semilunar cartilage, which will be known as medial meniscus. So therefore, now here we will show one posterior cruciate ligament, because this posterior cruciate ligament will come in relation with the meniscofemoral ligaments. So posterior cruciate ligament, which we had discussed in earlier segment, the posterior cruciate ligament is attached in the posterior intercondylar area of the tibia that we have discussed in the previous segment, lower attachment. So therefore, now the posterior cruciate ligament, if I show with the blue color, it is attached on the posterior intercondylar area of the tibia. Above it will be attached to the lateral surface of medial condyle of tibia. Lateral surface of the medial condyle of, not tibia, but femur. So above it will be attached to the lateral surface of medial condyle of femur. So therefore, it will be attached in this way. This is posterior cruciate ligament that we have already discussed. So as the upper attachment of posterior cruciate ligament is on the lateral surface of medial condyle of the femur, the meniscofemoral ligament will pass from the posterior horn of lateral meniscus. So let us draw the meniscofemoral ligament passing from the, let us take this as the cross section of the lateral meniscus. So it will pass from the lateral meniscus, posterior horn of lateral meniscus, and it will cross the posterior cruciate ligament, and it will be attached where? To the medial condyle of femur. But here, this meniscofemoral ligaments, there are two, as I already told you, anterior and posterior. So both the ligaments, this anterior and posterior, they are termed in relation with the posterior cruciate ligament. The anterior meniscofemoral ligament will pass anterior to posterior cruciate ligament, and the posterior meniscofemoral ligament will pass posterior to the posterior cruciate ligament. As simple as it is. So therefore, this ligament is posterior meniscofemoral ligament. So here it is crossing the posterior cruciate ligament from posterior side. Anterior will cross from anterior. So we are going to draw the anterior in this way. It is crossing in the anterior part. So it will go behind the, from this angle it will go behind the posterior cruciate ligament, because this angle, remember, this is the posterior view of the coronal section of the knee joint. This is the posterior view. We are looking at the coronal section of the knee joint from posterior. So therefore, this will be posterior meniscofemoral ligament and this will be anterior meniscofemoral ligament. Anterior will pass anterior to posterior cruciate ligament and posterior will pass posterior to the posterior cruciate ligament. Very simple. And what are meniscofemoral ligaments? They are connecting the posterior horn of lateral meniscus with that of the medial condyle of femur in relation to posterior cruciate ligament. So now let us mark these ligaments, let us name them. So therefore, we are going to mark first over here, lateral meniscus. Of course, from the posterior of lateral meniscus. Next, we are going to mark this as posterior cruciate ligament. Next, we are going to mark here these two as meniscofemoral ligament. Be careful in marking. Now here, this portion, we are going to mark it as the posterior meniscofemoral ligament. Posterior meniscofemoral ligament. Now here, you have to remember the name because one mark question answer or MCQ is asked based on this name. What is the name of posterior meniscofemoral ligament and what is the name of anterior meniscofemoral ligament? First, we'll just write down anterior and posterior meniscofemoral ligament. Now here we are going to mark this as the anterior meniscofemoral ligament. Anterior meniscofemoral ligament, posterior meniscofemoral ligament. What are the other names of these two ligaments that you have to remember? Anterior meniscofemoral ligament is known as ligament of Humphrey. So please write down over here, ligament of Humphrey. H-U-M-P-H-R-E-Y. I hope it is visible. So ligament of Humphrey, anterior meniscofemoral ligament, ligament of Humphrey. Posterior meniscofemoral ligament will be known as ligament of Brisberg. Please write down W-R-I-S-B-E-R-G. These two are very much asked in one mark question answer in MCQ. What is ligament of Humphrey? What is ligament of Brisberg? Ligament of Humphrey is the other name of anterior meniscofemoral ligament, and ligament of Brisberg is the other name of posterior meniscofemoral ligament. Now, what is the function? What are the functions of these two meniscofemoral ligaments? The functions will be, since it connects the posterior end of the lateral meniscus with that of the medial condyle of femur, it will help in the forward movements of the lateral meniscus during the extension of the knee joint. So it will help in the forward gliding of the lateral meniscus during extension of the knee joint. So here, please come on this side now. We have finished the meniscofemoral ligaments. Coronary ligaments, transverse ligament, meniscofemoral ligaments, and now in the last we are going to deal with the medial meniscus and lateral meniscus. For that, this diagram is sufficient over here. Now medial meniscus. Please try and understand. If we consider this medial meniscus, semilunar cartilage, both the menisci, medial and lateral, they are semilunar cartilages. And both the menisci, they are fibrocartilage. So please note down, they are a pair of fibrocartilages, medial meniscus and lateral meniscus, both together. So they are fibrocartilages, they are semilunar cartilages. Medial meniscus will have anterior and posterior end. Also the medial meniscus will have superior surface, inferior surface. The superior surface will be concave. It will be in relation with the medial condyle of femur above. Inferior surface of medial meniscus will be flat. It will be in relation with the upper surface of medial condyle of tibia. Now, this medial meniscus will have medial border which is convex and lateral border, where I am passing my finger, this is the lateral border. This lateral border is concave. Lateral border over here, this lateral border is concave and free. It is a free border. What about the medial border? The medial border is convex. What structure is attached on the medial border? Fibrous capsule. And along with this fibrous capsule, which part of the ligament is attached here? the deep portion of tibial collateral ligament. Remember, that also we have discussed. So the deep portion of the tibial collateral ligament will reinforce the fibrous capsule at this level. That means the deep portion of tibial collateral ligament will be attached along with the capsule to the medial convex border of the medial meniscus. So therefore, here you can even mark, if I mark with the, let me mark with the green color, this I can show that this will be the attachment of deep portion of tibial collateral ligament. So therefore, here please mark this as the deeper part of tibial collateral ligament along with capsule, which is attached to the medial convex border of the peripheral part of medial menisci. What is the shape of medial meniscus? Semilunar or oblong, in which the anterior-posterior length of medial meniscus will be more, it will be greater than the anterior-posterior length of lateral meniscus. Now we discuss the lateral meniscus. In the same way as we have discussed the medial meniscus, lateral meniscus. Very simple. The lateral meniscus will also have anterior end and posterior end. It will also have medial border, lateral border. The posterior end of lateral meniscus is connected with, we have studied over there, anterior and posterior meniscofemoral ligaments. So the posterior horn of lateral meniscus will be connected with anterior and posterior meniscofemoral ligaments for the forward gliding of the lateral meniscus during the extension of the knee joint. Now, this border of lateral meniscus, which is known as concave or medial border, is free border. What about the lateral border, which is convex? This lateral border of the lateral meniscus, which is convex, will be attached to the capsular ligament. Similarly, the posterior end of the lateral meniscus will be attached with the tendon of popliteus. So therefore, there will be popliteus muscle which will be attached to the posterior end of lateral meniscus. And why this popliteus muscle is attached to the posterior end of lateral meniscus? So that it will prevent the nipping of the posterior end of lateral meniscus during flexion of the knee joint. So therefore, this popliteus muscle during the starting phase or initial phase of the flexion of the knee joint will pull the posterior end of lateral meniscus, and therefore it will prevent the crushing of posterior end of lateral meniscus in between the condyles of femur and tibia during the initial stages of flexion. That is why the posterior end of lateral meniscus will be attached with the popliteus. Similarly, the lateral meniscus will have superior and inferior surface. Superior surface will be concave, the inferior surface will be flat, just like medial meniscus. Therefore, the lateral meniscus will provide attachment with what structures? Number one, laterally, the convex border will provide attachment with the capsule of the knee joint. Posterior end will provide attachment with the, here if I just show you, posteriorly it will provide attachment with anterior and posterior meniscofemoral ligaments. And the third attachment will be popliteus muscle, which will be attached to the posterior end of lateral meniscus. This much you have to understand. What about the attachments of medial meniscus? That already we have discussed. Medial meniscus, the convex border or the medial border of medial meniscus will provide attachment to two structures. Number one, capsule of the knee joint, and number two, deep portion of tibial collateral ligament. These are often asked as one mark question answer or MCQs. So therefore, both the menisci, now we have understood both the menisci, they are a pair of fibrocartilages, semilunar cartilages, which are present between the condyles of femur and tibia. But there will be some space left. So they will divide the knee joint into two compartments. What are those two compartments? Upper compartment, which is called meniscofemoral compartment. Lower compartment, which is called meniscotibial compartment. Once again I repeat. So Menisci, medial and lateral menisci, will divide the entire knee joint into meniscofemoral compartment and meniscotibial compartment. With this, we are finishing all the ligaments of the knee joint. We started from capsular ligament, synovial membrane, and we ended with the menisci of the knee joint. So here we finish all the ligaments of knee joint. Thank you very much.